We have 3 psychiatrists
Okay.
on staff and 2 social workers,
Okay.
mental health social workers. So we have a lot of mental health availability
Okay.
if needed. We offer group sessions, women's
Okay.
group. We offer
Wow.
PTSD group sessions. We
Wow.
offer multifamily group sessions.
Wonderful. So
There's
you've got a
a
whole
lot.
variety of problems. So it's not just the physical, because the numbers that we're hearing sort of is that in the state of Michigan we have approximately about 1 million veterans we had in 2000, and we're down to about 700,000, and that number is going to decline a little bit. But the kids coming back from Iraq and Afghanistan, we have so many more survivors that it sounds like there's a lot of demand for additional services in the mental health area.
Right.
Is that appearing to see sort of what?
It is apparent, yes.
Yeah. And sort of because of the ability for us to save these kids in combat, they're putting more stresses on the system.
I wouldn't say stresses.
It's just more. There's more demand for services.
There is more demand for services.
Okay, that makes sense. And so if you have sort of what you're considering sort of some psychiatric issues, is that the same process you have to or how does is that sort of like the Agent Orange that they go and apply, or how do they in the psychiatric side? How do you access that?
Well, like I said, you get established with a primary care
Okay.
provider, and the primary care provider will then order any consultations.
Okay.
As a result of that visit, whether
Okay.
it's mental health services or physical therapy or neurology.
Okay.
So,
And so then, the always the gatekeeper then is to get your basic physical and sit down with your doctor to get just a recommendations of sort of the issues that you have.
yes.
So then you've got a broad level that you take care of there. So then, if they don't have the services available there, you go to Saginaw? Is that how that works?
Specialty appointments are usually scheduled in Saginaw.
Okay.
There are other specialty appointments that you might have to travel to Ann Arbor.
Okay.
Or Battle Creek.
Okay. And so, can you give me some of the examples of some of the specialty appointments that you might have in a Saginaw or a?
For instance, orthopedics.
Okay. So if you lost a limb or that sort of thing.
Right, that would be a consultation down to either Detroit or Ann Arbor, depending on the body part.
Okay. And then you do eyeglasses down at
We do
those?
have optometry located down in Saginaw.
We have
Just a-
audiology.
Audiology.
We have audiology,
Oh, so if you-
optometry,
yeah.
podiatry,
Wow.
cardiology,
Okay, so
urology,
hearts and-
neurology, the whole
Whole
all the
gamut,
allergies.
yeah.
That,
Because I was talking to, I bumped into a friend of mine who served in the military back in the 50s, which was in the Cold War, and he was in an Air Force unit and had hearing problems, and he went down to get hearing aids fitted down in Saginaw. So it's a real diversity of issues that you cover there.
Right.
Now, what's the history of the Saginaw facility? Can you tell a little bit about the complex and what it's like? Is it easy for people to access if they're...
It's located on Weiss
Okay.
in Saginaw.
Okay, so
and
right in the city.
It's outside of the city.
Okay.
It's closer to the expressway,
Okay.
so it makes it easier for the traveling veterans. It's a very large complex.
Okay.
It can be intimidating.
So is it got 50 beds, 100 beds?
We have 81 beds in our community living centers,
Wow.
and then we have 15 beds in our what we call 3B floor. That would
Okay.
be somebody coming in with an issue that needs to be hospitalized
Okay.
for a couple of days. The community living centers cover respite.
Okay, for like families that have problems
Yep,
with...
there's, I believe, 30 days
Okay.
that they use per year.
Okay.
And they can use it at any different times if they just need a couple hours here and there, if they want a weekend or what
Okay.
have you. There's inpatient physical therapy rehab.
Okay.
There is also the palliative
And
care.
palliative would be heart and those types of
Palliative would be that you're coming in to manage some symptoms of
Okay.
what's going on, or end stage,
Okay.
end of life stage. And then we also have wound care. So if
Oh,
you've
really?
got some issues there and you need to come in for a while and have those managed,
Okay.
gotten back under control so that you can go back home.
Wow. So that's really sort of the whole time is that after you go through getting your diagnosis and working through this, and you may have to have surgery or a variety of long-term health care. Now, are you seeing any changes in sort of the demand for health care from this current set of veterans versus maybe the Vietnam or the Korean War veterans at all?
Well, we do have a large influx of veterans just returning back from combat,
Sure.
which is to be expected, but one of the largest groups that I see coming through my office is the Vietnam veterans.
Really? Yeah,
they're
'cause
hitting that retirement.
Yeah, that
they're
would make
hitting that
sense.
retirement time with the changes in the coverage of health insurance after retirement, problems with companies and what have you. They've been coming in for care when at that point they really haven't. I get gentlemen that come in that said, well, I was here in 75, but I haven't been here since, and I'm looking to come back in. So.
And so that's a thing to point out is that if people thought that they had very good health care with their companies that they retired from, and because of their income levels and changes, this may be an option for them to take a look at.
Well, I believe it's an option for everybody. Everybody should take the time to apply for it, just to find out if you are eligible or not. Because if you are a veteran, you should take the time to find out if there are services. Unfortunately, it does drop with that income being a factor, bearing with what your eligibility is. But, prisoner of war, Purple Heart, if you're service-connected for any disability, that's going to bring you through the door.
Wow.
Okay.
Wow.
Agent Orange exposure for our combat veterans in Vietnam, that brings you through the door.
Now you're seeing I saw that we just are finishing up like the anniversary of the first Gulf War. Have you seen any of the Gulf War syndrome as people coming in for any of those types of things?
There's been more of that in the CMP clinic.
Now what is it, and I apologize, what is the CMP clinic?
Oh, I'm sorry, I apologize. That's the Compensation and Pension Clinic.
Okay, very good.
And that's for those environmental factors.
Okay.
Because
Right,
there
we
were,
talked about that,
in the 91, in
Yeah,
that time frame,
right.
there was a lot of exposure to the burning oil wells. And there was a lot of health issues regarding that. And so, yeah, they're coming in and seeking care for that where previous years, it hadn't really been recognized, even with the Agent Orange.
Right.
The recognition with Agent Orange is growing every day, where we didn't have that before. So,
Wow. Are there any other sorts of environmental designations that people should think through that they may have been exposed to?
well, there's ionized radiation.
Okay, so that's sort of from the Cold War, from the...
which you don't see a whole lot
Right.
of. The Agent Orange is very... than anybody from the Gulf War.
Okay.
And then there's, any toxic embedded things that you have from any accidents that may have happened. They look into that. There's about 5.
Wow.
But there's also, the Camp Lejeune water.
Yeah.
So we have had a few calls on that. I'm not in the Compensation and Pension office, so I don't hear them all, but I have fielded a few questions through there on that. So people received that letter and want to know what they should do to follow up, and that's the clinic that they would contact.
Wow, that's amazing. So the diversity of issues that you have to work through has got to be just fascinating.
It is. It's a very multifaceted, exciting job. There's no boredom. There's no you hit any point where it's ever changing. There's always constantly something that comes up different. A veteran struggling to get a DD-214, and you've tried all the normal options in trying to find it, and then you find out, well, you can actually go through Atlanta, Georgia, and have them check with the FBI to look for DD-214s, which amazes me that you have to go so far to find a piece of paper that was missing from years ago.
Right, because we in our state, if you were in the military in the state of Michigan, we have a pretty good inventory of those records, and that's that's the part of the process, and we're grateful for you guys coming on. Is the communications of the issues that are out there, because I think one of the things that we don't have an opportunity to do is to celebrate the efforts of these veterans and what they've done, and they've earned these benefits. But making them aware of them is so challenging.
Making them aware of it and making them willing to come in and check into it. I get a lot of veterans that come in and say, well, I'm not looking for charity. I've taken good care of myself all these years, and it's not charity. It's there provided for you because you have served for us. So it's actually a service that you deserve to receive as opposed to asking to have a handout. And that's one of the misconceptions of our Vietnams, our World War II veterans.
Now, going back to the sort of the local operations, you're in the Traverse City area, and so do you have people coming in from maybe 4 or 5 counties? Is that how that works?
We have counties as far south as...
probably Cadillac, 50 miles, 60 miles?
I'm thinking Mason County.
Wow.
We have veterans from Mason County coming up to Traverse City. We have people from Petoskey. coming down, Mason County.
Wow, so you've got it all over the area.
Right.
And so that probably then creates a interesting, so you're, like on your typical clinic hours, are you open like 9 to 5? Is that how that works?
We're open 8 to 4:30.
8 to 4:30,
Yes.
so you got an early morning, so if somebody needs to come in, they can still get part of their day back.
Yes.
And then the typical way that this works out is that you've had your initial primary care. Do you do the dispensing of the drugs there too, if the physician requires some sort of pharmacy assistance, or how does that work?
Our pharmacy is located down at the main facility in
Saginaw. Okay.
Right. They get mailed to the veterans.
Oh, that's convenient.
There is on occasion, if you need an emergency medication, we may be able to, get it filled for you that day.
Okay. So there's some flexibility, but it's primary.
Yes.
And then are they then required, you get the script, and then are they required to go down to Saginaw for the first visit for their scripts, or is it generally just dropping them? Wow, that's very convenient. Now, do you do any dental work at your facility, or is there dental work available?
Dental is available down in our Saginaw facility. Yeah.
Which is another great aspect of things going on.
Right. Although dental is, it's all depending upon eligibility.
Okay.
On certain services.
Yeah,
So.
dental is for the 100% permanently totally disabled veterans or former prisoners of war, vocational rehab program, or if you have a service-connected rated injury to the mouth.
Okay.
So it's not available to everybody, which is unfortunate, but that's how it's designed.
Okay, so there's a set of rating systems that were set up, and that's part of that one office that does sort of the aspects of what we talked about with the Agent Orange, and we talked about...
It would not fall under compensation pension. It would fall
Okay.
under eligibility, the same department that you enroll through. That's
Okay.
our department that you would have to contact us, and we'd have to determine if you are rated for a disability and rated as unemployable, you could be eligible for dental.
Okay.
But if
now, how does that that's part of working through your veteran service officer to get a disability?
Yes, getting a rating for the percentage of disability that injury is causing.
Okay, and that could run anything from like about 10% all the way up to 100%?
Actually, 0%.
0%?
Yes.
Okay.
Yes.
Okay, very good. And then is that a stipend? Is that how that works? Is that a stipend that you get?
Yes, they do receive money for the percentage, according to the percentage that they've been granted.
Very good. Now, your website, that has sort of your overall, what the different types of programs that you can do at Saginaw, or is that more of it at the Global VA website as far as
the Saginaw VA covers what's local,
Okay.
and then I believe there are additional, what do you want to call them?
Right, programs and those types
Connections.
of things.
You can go out,
Right.
from that point
Wow.
beyond.
Right, very good.
Links, that's the
Now,
word.
Kelly,
I was
are you
looking
part
for.
of that as far as your website? Do you have...
Cindy, are you part of
sorry,
that?
I'm sorry, I apologize, but Cindy, are you part of that as far?
The outpatient clinics do, you do link to the different locations
Okay.
for the outpatient clinics
And
and
so
the
then
different
do
services.
you have a part on the website then that shows the Traverse City Center there?
Yes.
Okay, very good. And they've got all the different contact information there.
Right.
Wow.
And the services available at each community-based outpatient clinic. So.
Well, it's hard to believe that our half hour is just about up. Is there, Kelly, any closing comments you've got for us of things that we should? I know you mentioned you've got your Saginaw VA website, which is saginawva.gov, right?
Yeah. Saginaw.va.gov.
Okay.
Yep. There's also e-benefits, which allows the veteran to view their medical records, update their medications, just a whole facet of things there, and that's e-benefits.
Okay.
ehealthbenefits.gov.
Okay.
.va.gov. I have a handout for you, so you'll
Okay,
be able to put those up.
Up on the website.
Yeah, because there's multiple sites that you
very
can
good.
access there.
Very good. Anything from your perspective as a local operator for these? Any concerns that or things we should know?
Just that the VA is there to help you, and please stop in.
Great.
Yeah.
Great. Well, we really appreciate you being here today, and it's been a very informational discussion, and I've learned a lot because new on the job, it's fascinating every time you sit down and talk about these issues, and I know our listeners have learned a lot about the services and the way to access this. So thank you very much.
Thank you.
Thank you.
This concludes our Veterans Update. I'm Senior Deputy Director Jason Allen from the Department of Military and Veterans Affairs. Below, you'll be able to see our access and information data. Thank you for joining us today.